Hello, and welcome to Module 6. My name is Lexi, and I am one of the Provider Relations Representatives at Delta Dental of South Dakota. In this module, you will see a mock risk assessment. If you have not enrolled your provider in Module 2 or went through the validation process in Module 5, you may want to stop this video and go back to the according modules. Once your patient has been entered into PreViser through the validation process, you can begin a risk assessment on that patient. Type in the search box the patient's last name. Select the according patient and click on Comprehensive over in the far right corner. If the patient has previously had a risk assessment at your location, there will be a Load Last Values button in the top right corner. Click on this and begin the risk assessment. If this is a patient's first risk assessment, you will be brought directly to the risk assessment. Again, notice all the questions are defaulted, so only change what is applicable to the patient. If a question doesn't apply, for example, if your office does not bacteria culture, leave the question to the defaulted answer of no culture or test is available and move forward. For the following 4 questions, begin with how many erupted teeth are present in the oral cavity. Be sure to exclude third molars. The reason for this is when the assessment was clinically tested, it was based on a predictable model, so it can be transferred to a mass audience. Since majority of the population does not have wisdom teeth, 28 teeth were used when building the standardized model for calculation. These 4 questions should be answered on every risk assessment, no matter if it's the patient's first risk assessment or the 5th. These questions are likely to vary from assessment to assessment, which is why it is important to ensure that they are accurately answered on every single assessment. The next section that says, check all that apply, are likely to be answered on the first assessment and then updated only if applicable every time after that. The majority of these questions can easily be answered by the patient. When you get to the cigarette smoking, pipes or cigars, and smokeless chewing tobacco section, notice everything is defaulted for a healthy patient. If the patient currently smoked or smoked in the past, you have to answer the drop-down questions of amount, duration, and status. The same goes for addressing alcohol use. When addressing the patient's diabetic status, ask the patient their HbA1c or glucose levels. If the patient does not know what those levels are, make a clinical judgment call and select fair or poor diabetic control. The remaining section is addressing periodontal disease. If the questions do not apply, you can scroll to the bottom and submit. If you have begun probing and looking for bone loss on the patient, answer the questions accordingly. For example, if the patient has any furcation involvements, vertical bone lesions, or had periodontal surgery for pockets, select accordingly. The next 2 questions are based on sextants. The first question is addressing the deepest pocket per sextant from the gingival margin to the base of the sulcus. Specifically, does the patient have any probing pocket depths greater than 5 millimeters? If no, then leave the defaulted answer and move on. If you are not charting or looking for probing pocket depths on this patient at this specific appointment, pull up the most recent probe charting numbers and answer the question accordingly. Do not forget to answer if the patient has any bleeding in the sextant. The final question is measuring the X-ray distance from the CEJ to the bone crest. Again, it wants the measurement per sextant. Look at your bite wings to determine the measurement of bone loss. This can be an eyeball estimate. It does not require you to pull out a measurement tool. If X-rays are not available, leave the defaulted responses and move on. These 2 remaining questions can be answered ahead of time by a dental assistant, for example, and entered into the assessment by clicking Save for Later. This last section, that is perio-focused, should be answered every single time, no matter if it's the patient's first assessment or 5th, considering they are likely to change. At the bottom of the assessment is a treatment options button and a laser therapy button. We recommend selecting the treatment options button and the laser therapy if that therapy option is available at your office. The final step is to click Submit in the top right corner. The Model This Patient button will show you a real report and is a great tool a clinician can use to show a patient how their oral health will be affected if different measures are taken. For example, if a patient were to stop cigarette smoking, this patient could see how their oral cancer score would decrease. But remember, the Model This Patient button does not submit the report to Delta Dental of South Dakota, so additional benefits do not get unlocked until the report is submitted. The Save for Later button is used when pre-filling information before an actual assessment is being completed. When clicking Submit, this will generate the report for the patient and unlock additional benefits for a patient if necessary. Notice, the report is easy to read, written in patient terminology so that the patient can easily understand how to improve their oral health. Each score will have a description below to further understand why the score is at that level that it is. The next section is general oral health tips for the patient to follow. After that is a section that will address pocket depth and bone loss. The most important section to the patient will be the What Can I Do section. This will address the steps the patient can take to improve their oral health. This report can be printed out for patients to take home. To understand what benefits the patient unlocked, select Check Benefits at the top. Scroll to the section where you see the red text. The first sentence will indicate if the patient's group has health through oral wellness benefits or not. If they do, the next sentence will address if the patient unlocked additional benefits, and if so, what category specifically. The Click Here button will go in depth what the additional benefits are. For example, if a patient unlocked perio benefits, the Click Here link would generate a pop-up message that explains perio benefits are 4 cleanings and 4 fluoride treatments per benefit year. Once you see the congratulations message, it is up to the dentist to determine what is best for the patient. The unlocked additional benefits can be performed the same day of service or scheduled out for a later date. Keep in mind, all the benefits refer to the individual's policy and are subject to be taken out of the annual maximum. As long as the patient's risk assessment is updated 1 time per benefit year, the patient's benefits will remain active. This is an important program and can be a big adjustment in terms of every individual's routine. Ease into the program at your own speed, but the more assessments you do, the easier it will become. Practice as much as possible and reach out to us at Delta Dental of South Dakota whenever you need assistance. We are here to help. We have trained many offices over the past year. Each office has successfully implemented this program in their own way. We are so excited to have your office on board and cannot wait to help improve the oral health of your patients.